So hi, Dr. Arni. Can we begin by introducing yourself?
Okay, my name is Arni Djunadi. You can call me Arni as usual. So right now I'm a first year internal medicine resident in Richmond University Medical Center, Staten Island, New York.
And where are you from?
I come from Indonesia, a tropical country back in Asia.
Thank you. And how do you typically start your mornings?
So for me, typically our morning is just like, like a really busy intern, a really busy intern day. So probably you wake up in the morning like around 5:30 or 6, and like for me, I like to do like 10 minutes workout or something to just to refresh myself. And probably I will do the like prepare to the hospital, maybe praying in the morning and go to the hospital. And probably after that, just we have like morning report for 2 hours, and after that we will go to the floors checking the patients endorsement. And yeah, that's how your day start, like day by day.
And how do you relax after a long day of work?
I mean, like uh relaxing myself, it's basically like reading some books outside medicine and hearing some music. And I think that will be really really like recharge me on my daily basic. I think it will be really nice just reading books and yeah, that kind of stuff.
Awesome. And can you share what specialty you are in and why you chose that specialty?
I'm an internal medicine resident at this point. Why I choose it? So it's really, really in the same things that I did when I was in Indonesia. So when I was in Indonesia, I already worked as a general practitioner in hospital and clinic for almost 3 or 4 years at that point. So I really like how to building rapport with the patients. I know at one point like hospital and clinic have a really different setup, but most of them, like, I like to talk with the patients more. I like to know how it is going, and I like maintain the relationship to have like years and go to the family again. So, and also internal medicine is board. You can like know from head to toe, something like that. So I feel like when I choose this specialty, it's really fit me well. And probably later when I do fellowship, I will choose something like kind of have a good things, that good communication skill with the patients also.
Yeah, and what type of patients do you usually see?
So in our hospital, because we are community hospital, we have like a lot of variety of patients. I have cancer patients, sometimes critical care patients. So it's just like, at one point you even can get an eczema patient. So it was like really diverse.
And can you share a memorable experience you had with a patient before?
So I think this is like one of the story that I really like. When I need to share, I have like a really memorable story when I still work in Indonesia, when it's the COVID time. During that COVID time, as we remember, at that time we never know what is COVID, we never know what is the virus itself. So the patient who got that virus, we need to isolate them from the family. So it's basically like we're really close to the patients, but we also cannot like the family cannot meet the patient itself. So we are really really become the communicator between them. And at that time everything was like really dark, like even the patient, one time they go to the isolation room, they go to the ICU unit, they never know whether they can come back again to life or not in the back to the world again. Because I still remember, like in my hospital at that time, like you don't even have like a window. So it was like really really like you never know what is, whether there is like afternoon or night. So I still remember, like there's a patient, like one patient that he is like alert and oriented, but he was like really old and he needs to be intubated, but he's alert oriented, so he needs to be intubated like willingly, without, it's not like because he's like desaturated and he need to be intubated like for the safe, but he was like desaturated like little by little, and we know that the ventilator is the thing that he need to have. So we persuade him. He doesn't want it. It's a really hard time for me at that time. So we try to convince him a lot for this kind of matter. We try to convince him that intubation is like one of the thing he needs to get. And even at that time, like his wife is like convincing him from phone and outside. It was a really beautiful time. I feel like I'm so close with the patients and the family itself. And the saddest part of this kind of story is like that the patient at the time was uh the patient itself at that time like willingly to be intubated, and he write a letter to us and also to the wife. He said like, I will just go for a while and I'll be back and I will see you again, because he really loved his wife. But in fact, like after a couple days, like he didn't make it. So it was like a really sad story for me, but it's a really unforgettable memory that I have as a physician, like how to building a rapport to the patients and to the family, and how we share a sad story to the family patient itself. So I think that's one of my unforgettable memory during that period.
Thank you for sharing. And can you share one memorable experience you had with another fellow healthcare professional?
I think for me, like that kind of story, it was like you can feel like in the daily basic, because we come from different country, we come from different background, we come from different language. Even like sometimes English is not our first language. So how to work with this kind of all of this into one time. So it's like because you change your team like every week. Every week you change your co-intern, you change your co-resident, you change your attending, and how you play it well. And you also change your nurse. So sometimes you need to become someone like the team player, sometimes you need to become the leader. So it was something like that. And but it's really enjoyment, like how the teamwork is going. So for me, communication and teamwork is like the perks of like all of this kind of stuff. So I feel like really like my connections with my co-worker. It's sometimes you don't need to be a friend, but the most important, when you come to the hospital, you remember that we have patients that we need to treat. We are colleague. We need to do what can we do the best for the patients along our personal issue or whatever is it. So I think it's kind of the things that I still remember as a with the co-worker.
And in your opinion, what are some traits that make a good healthcare professional?
I think being kind and humble. I mean, hard worker is a must, clever is a must, but I feel like being humble and kind is like I think like one of the trait that we need to have as a ongoing healthcare professional. Why? The most important why I say is kind. Like sometimes we don't know what happened behind this patient's life. He just come to us and he have like some problem and he want us to resolve his clinical problems. And we need to hear them basically. But sometimes he has something, or they have something beside them, and sometimes to learn their problem, being kind with them, I think it's the most way as a healthcare professional to have empathy with your patients, and like knowing their story more. I think that's one of the point. I feel like if you want to become a good healthcare professional, just being kind with everybody, being kind with your patients, show empathy. And you didn't need to know whatever happened behind them, but show respect and like hearing them.
And what aspects of practicing medicine do you find the most challenging?
I think I think at this point, like we still have not have like all generalized equipment in every hospital. As an example, if you compare like my hospital and like Northwestern, of course, the time when we did the observership, it feels so different. Some we does not all we don't have all the specialized that we have in there, as an example. Like, so it's like shortage of shortage of some stuff. So I really hope like it doesn't mean like a smaller hospital, like you have like really really like hard to work on that, not something like that, but it's just like if you have more generalized, like how to have more supply in the community hospital or in a smaller hospital, then the access to the patients or the outcome to the patient will be better. As an example, if in the bigger hospital you have like better technology, like all specialists, so of course the outcome of the patient will be better. That's how we try to compromise with ourselves day by day to give the best that we can do as a healthcare professional, even we have doesn't have uh, a lot of material as a bigger hospital.
And what aspects of practicing medicine do you find the most rewarding?
Of course, when you see your patient happy, and I think this is like a really easy thing. If your patient remember your name completely, like they know like your name, like they remember that you've been taking care of them like previously. I feel so it's so rewarding for me, especially like if they are healthy. I feel they are healthy, they are happy. They when they go out, they're feeling well. Of course, that's the most rewarding for us as a physicians. What else we can do as a doctor, basically?
Thank you. And how do you collaborate with other healthcare professionals, such as physicians and nurses?
Of course, communication and teamwork. Like I always respect my nurse, basically, and my colleague. As an example, like when every day I come to the floor or something, I always introduce myself to the nurse that I work for. Because why? Because they are my colleague at that day. They're my colleague at that week. We are teamwork. We are working as a team. So there's nothing as like hierarchy or something. But when you see the patient, we are working as a team. It's a nurse, it's a colleague, whatever is it. At least I know their name, they know my name, and they know how to reach me. And being responsible with your work is the most important. If you cannot be responsible with your work, how can people like believe in you, believe in your job, dependable on you? No, you should be responsible with your job. Every job that been access to you, you need to do it. You need to do it. I think that's the one thing. So even you do it in teamwork, people can depend on you. People know that you can be trustable. So that's how you do with teamwork, I think.
Thank you. And how do you build trust with patients in your care?
I think again, like I'm telling, like building trust is meant like you need to put an effort at that. You need to put time on that, like you need to put time on your side. Sometimes you don't have time because you're busy. You have like 13 patients, 12 patients, like 11 patients a day, 10 patients a day. You never know like how it goes, like you have. But if you want to build trust with them, you need to spend time with them, you need to talk with them and build your rapport. And of course the most important, like keep your word, like. But sometimes I can say like it's not that as easy because we following up a lot of patients for daily. But as an example, if I see these patients daily, and if they ask me something and I said like, okay, okay, I promise you I will finish this thing today. I promise you I will talk with as an example, to the ID doctor or to the hemong doctor, so we have get recommendation. So I think that's how you build rapport with your patients, like when you say something, you promise something, you need to do it. So they know that, oh, this doctor is dependable, and the doctor check on me. He knows me, It's like the same, like you will be like feel safer when you know that the one who take care of you like knows you. I think that's one of the trait, like how to build a good rapport with your patients.
And what is the greatest lesson you learned from your overall medical experience?
I think, to be honest, for me, other than kindness that I can tell you earlier, I think it's being humble. Because when I go in this kind of uh, positions and I see more, I think like we are as a doctor, we need to be like more humble. I learned a lot when I was in Dr. Che lab, like how humble he is to the patient and how humble he is to the coworker. I feel like I think it's really important for us, even like younger generation, to be like realize that there's always someone above us. Like there's always like you can be the smarter or something, but you need to be remembered that everything, there's always some sky above sky. So I think like humble is like one of the way that you become, like you can learn more from that. When you being humble, you can learn more, you can absorb more from your environment, you can be trustworthy more with all the friends and the colleague, also your patients. I think that's one of the greatest lessons that I got in Dr. Che's lab at that time. And also when I practice this as an internal medicine resident at this point, I feel like being humble is like one of the things that we need to keep, or we need to remain as ourselves as a younger generation and as a physician.
And what is a challenge you feel healthcare professionals face today?
Again, I think like the generalizing of the healthcare professional, at some point you don't have a lot of resource, at one point. So you lack of resource, so you need to be more creative in one place. You need to be more up forward with the plan that you want to do for your patients. So I think it doesn't mean like less resource is bad, but it makes you like more creative, more upcoming, like more upfront with your plan, with your recommendations to the patients, and how to make it work with your coworker. I think that's one of the things that we can do as a physician and as this kind of work right now.
And last question, what is one piece of advice you have for aspiring healthcare professionals?
Never give up on your dream. I think wherever you are, it doesn't matter where you're working. Even like at one time I said, okay, I can stay working in Indonesia, it's fine, as long I can take care of patients there. It doesn't matter where you're practicing, as long you remember what is the purpose of your become a physician. Is it money, or is it because of your patient itself, because you want to make this work better, or you want to like just taking care of people? Just remember like the basic of your purpose to become a physician. And no matter wherever you're working, even it's like in another state, in my state, or like in different country, just remember like we become a physician because we want to take care of our patients. We want to make other people healthier. So when you come there, just put that in your mindset. And I think, again, be kind and be humble. So, and learn more. I think that's one of my piece of advice, because even until now, I still want to learn more with my mentor, with people around me, even from the nurse. I want to learn more about them, because in some area they are better than me. I just want to learn more from other people, because I still know I'm a person that a lot of lack. So I want to just learn more from other people. I think that's the thing.
Thank you so much for sharing your story.